And howdy, everyone. Welcome to what quite possibly may be the best insurance presentation that you have attended today. How about that? My name's Ben. I work for a company called Catto&Catto or Hub. We go by both names, along with Ann and Jim. We are the Kaspar Company's insurance broker and consultant and have been fortunate to work with the team for a long time, designing and managing and monitoring and implementing everything that goes into this guide. Depending on your familiarity with some of the things that we're going to talk about today, you might go hallelujah, you will at some parts, and at some parts you'll go, okay, I didn't totally understand that. And that's completely fine. We want you to be able to ask questions to your HR team and, of course, ourselves all throughout the year, because we have designed this program to operate as efficiently as we possibly can, excuse me, while also delivering the best possible value that we possibly can. Here's where you're going to go to say all of your yeses and nos. easykaspar.com, easykaspar.bswift.com. Fill in your new username. Password will be last four of your social. You'll make all of your choices on anything that we talk about today online at easykaspar.bswift.com. We're going to talk about medical, dental, vision, life insurance, and then what we call worksite plans, or either accident or critical illness. COBRA just means if you leave Kaspar, that this coverage can go with you. So we have two different times where you can change your benefits. If you're a brand new hire, you can put yourself or your family on the plan. You can make a decision after you were through your waiting period, which is first of the month following 30 days after date of hire. Outside of that, then you have open enrollment. So we do open enrollment once a year. So if you're a new hire, you can make your choices. And then during our annual open enrollment, anyone can decide what they would like to do in terms of coverage on the plan. Outside of open enrollment, you have to have one of these qualifying life events: marriage, divorce, birth of a baby, spousal open enrollment, things like that, where the IRS says, yes, you can change what you chose. I don't like this, or something like that is not a IRS approved excuse. Okay. We're going to hit the meat of the presentation right at first. And so this is going to be the hardest part, but I do think it makes sense. It just needs to be explained. So we have a plan that is very favorable to hospitals and imaging centers and doctors and prescriptions that we have established fair and reasonable pricing with on the front end. And so there's three different types of benefit plans: Obama, Kaspar, and Buy-Up. You'll see preventative services, your annual physicals, mammograms, pap smears, colonoscopy if you're over 50. Those are all covered at 100%, meaning no cost to you. You'll see copays for office visits on the Kaspar plan and the Buy-Up plan. Copay is just a flat rate when you use something. And you'll see these different levels of deductibles. Now, these deductibles apply for non-network contracted facilities. We've got a whole host of facilities. Get this, this is a little hallelujah moment. We've got a whole host of facilities where the deductible and the out-of-pocket is waived because we have better pricing. How about that? So these deductibles would apply. You can go anywhere you want. It's just if you go to the places where we have already established good working relationships and pricing, deductibles and out-of-pockets are waived. That is amazing, which means that's no cost to you. So the deductible is the part that you pay in a non-contracted facility before insurance starts to pay. And these out-of-pocket maximums, I just reference the individual out-of-pocket maximums in these presentations because the math is a little easier. And so these out-of-pocket maximums are actually waived, meaning you are not responsible for them if you're at a direct contract facility. I will come back to everything I just scrolled over, but these facilities right here, I want you to see at the top here, these are facilities or hospitals where if you go and seek care, you do not have a deductible and your out-of-pocket maximum is not there, meaning you get to go to these facilities and it's no cost to you. That is an amazing hallelujah moment. Now, if you choose to go outside of one of those facilities, then this schedule of benefits would apply. So we do not have a network. Many people are used to saying who is in my network, who is not in my network. For hospitals, we have direct contract facilities listed here. If you choose to go somewhere else, then that deductible and out-of-pocket maximum would apply. Now let's talk about doctors. And I realize you might be getting a little seasick because I'm going back and forth through a bunch of different slides. Sorry for that. So if you go to the doctor, that is the Galaxy professional only PPO network. So what you're going to do if you just need to go to the doctor, doesn't need to be a hospital, go to galaxyhealth.net. That's where those copays apply. Go see the doctor, and the Galaxy network, that is where we do have a network, but it's only for doctors. It's not for hospitals, only for doctors. So the Galaxy Professional Only PPO network, it's at galaxyhealth.net. Those are the doctors that are in our network. Now, what if you need imaging? Now, let me see if I can switch so that I can rotate it. There we go. So if you need MRI, CT, PET scan, ultrasound, mammography, X-ray, what we want you to do, instead of paying a bunch of money for it, use green imaging. It's no cost to you. This is where another hallelujah moment. Your doctor gives you an order, you need an X-ray. You contact green imaging, text, chat, or call. They'll schedule your procedure and they'll give you a coupon or a voucher. At your appointment, you show your voucher, you don't have a copay, and the report gets sent back to your doctor. This is amazing. As an insurance nerd, I never get to talk about amazing stuff. It's always how painful this is. So in order to affect cost, we have to abide by the rules and find a way to do things more efficiently. This is one of those ways. So this is imaging, and use green imaging because there is no cost to you. Now, let me see, get back. Well, that's upside down. Okay, there we go. Now I'm going to go back up here, pull the presentation back up. So this schedule of benefits applies for non-contracted hospitals. For doctors, you're at these copays unless you're on the Obama plan. For the Galaxy Physician Only PPO network. For imaging, CT, X-ray, use green imaging. If you don't want to use the green imaging, then there will be a cost for that, and that's determined by the provider. We just covered all this stuff. Now, if you get what's called a balance bill, the reason we have these direct contracts is when you go into a hospital, we've already established what the prices are going to be and what a fair and reasonable cost is. It's brilliant paying a fair and reasonable cost. How about that? And so sometimes the hospital, or especially if you go somewhere else, like out of network, the facility is going to want this, and the bill is up here. So that difference is called a balance bill. So if that happens, I want you to contact the medical health line advocate, and the number is there. You can also ask us if you get a balance bill. You can also ask your HR team, but the direct contract facilities should not ever balance bill you. It doesn't mean that that never happens. Like, they're people too. And so we just want to make sure that if you get a balance bill for services at particularly a direct contract facility, that you know how to handle it. Now, if you go out of the network somewhere else, then we have a preset price. But if the hospital wants something up here, then you may get a balance bill, and we want to be able to negotiate that down. Couple of prescription drugs items here. I'm going to go back because I'm just going to reference right here. So let's talk about RX. So the Kaspar plan has a $150 deductible, not much, and then you've got these copays. The BIOP plan has no deductible and has a little lower copay. Now, with respect to prescription drugs, so just take note of these items. These are ways where we are operating within the rules, but seeking to be really wise about the spend. Because honestly, when we do that, the cost is less for you and it's less for Kaspar, and we can continue to deliver something that is actually truly exemplary. So Me Too drugs would have a limitation or exclusion. That's OTC or over-the-counter medications are chemically similar. So we're going to want you, if two drugs are very chemically similar and one is $1,000 and the other is 100, we're going to steer you towards the 100. Non-essential simply means the amount. If you're getting prescribed too much, then there's going to be a limitation on that. You'll hear a little bit more about Southern Scripts. Southern Scripts, as it relates to prescriptions, that is our pharmacy benefit manager. That is the vendor that we have hired, and we've been with them for a while now, who has been managing what's covered, what's not, the negotiated prices on all of our drugs. And so how you get your prescriptions is a couple of different ways. Okay, I want you to just take a look at here at what you may utilize any pharmacy of your choice. So we want to give you choice. However, you're going to get a cheaper bill by using the Southern Scripts Preferred First Choice Network Pharmacy. So if you want the best bang for your buck, use the First Choice Network Pharmacy. The Preferred First Choice Network includes pharmacies like CVS, H-E-B, Target, Kroger, Walmart, Rite Aid, and many others. You can utilize them as you see fit. These are not in the First Choice Network. So there's going to be a higher bill at Walgreens, Costco, Sam's, some independent pharmacies. Not all, some. Specialty drugs are available with a 30-day supply, and 90-day supply are available through a First Choice provider. You can get that through mail order. Okay, we're going to talk a little bit more. I'll come back to these, but just while we're on prescriptions. So we use a couple of different cost-saving measures. This is Southern Scripts. That is our pharmacy benefit manager. First Choice is the network of pharmacies that will give you the most bang for your buck. And then there are a couple of things within our prescription drug program that are actually pretty unique. So variable copay simply means if there's a coupon available for that drug, then we want you to use the coupon, and it's way cheaper for you, and then we'll mail it to you. How about that? It's kind of like, getting $1.50 off on bubble gum at H-E-B or something like that. We want you to use the coupon first versus paying more money out of your pocket. Specialty are just going to be more expensive medications, so you will still use the network pharmacy locator tool to find the pharmacy closest to you for any specialty drugs. And then you can also get it just mailed to your house. So it's pretty user friendly from that standpoint. This is more information on what that variable copay is. So just check it out. The cost is free to you if there is a coupon already available, and then we'll mail it to you. See, we use manufacturer provided coupons. Isn't it crazy that Big Pharma makes coupons for the drugs that they're making? If your medication has a variable copay and you try and fill it, okay, you will get a rejection notice saying variable copay opportunity available, please call. So that's the ding, ding, ding for you to go, okay, I can get this cheaper. It doesn't mean that I can't get the drug. It means I have to get it another way. Does that make sense? Okay, it actually says that pretty much right there. So if you have any further questions or problems, then you can call this. You can also call us or talk to HR about it. Southern Scripts also has an app if you like doing all this on your phone. So that's pretty cool too. Now I'm going to go back. This is just a good FYI, y'all. Sometimes there will be a freestanding emergency room, which is an ER with a big old bill attached to it. That is the same thing as a hospital emergency room. It's just not literally inside of a hospital. And so we just want to remind you, don't go to the ER unless it's life or limb threatening, because you're going to be sitting there, and then those emergency cases will walk in right in front of you. Healthiest You, check it out, 24/7, 365. Yes, they do have an app as well. 24/7, 365, this is telemedicine. So I used something like this for my third kid. She had pink eye. I knew it because her older brother had pink eye and half of his class had pink eye. Held the kid up, called the doctor. It was 15 minutes, and then they sent some amoxicillin. So it was pretty easy to address. Those are good examples of things to address via your phone. Free stuff, $15,000 of life insurance. You just got to keep showing up and being a good employee at Kaspar Companies. We do want you to put your beneficiary on there. That's where the proceeds of the life insurance go if you're no longer living. If you have a volatile experience with people, don't put the Johnny come lately or Susie did me wrong as a beneficiary on your basic life. Put somebody stable that you really like Trisha or Selena. They'll take it. It's free to you. I also have some will prep services there, which are actually pretty user-friendly. It's just form-based. It is definitely adulting when you're talking about doing that. It just makes sure that you are telling any assets that you have where they're going to go when you're not there. Mutual of Omaha cares about your teeth. It is the mutually preferred dental network. It's also a great way, boys and girls, to get a date, even if you're married. You know, if your breath stinks, ain't nobody going to want to be around you. So you got to brush your teeth and you got to take care of them. Otherwise, you know, it's just not going to be good. So we've got two different options, low plan and a high plan from Mutual of Omaha. Costs are right here. So the biggest difference is major services and ortho are covered on the high plan, low plan they are not. So let me give you an example of how this works. Let's say you go in and you get your 2 exams and your teeth cleanings per year. Those are free. Those are covered by this cost down here coming out of your paycheck. But then you've got a cavity or something like that. Cavity is $200. So you're going to pay, if you're on this high plan, or if you're on the low plan in this example, $200 minus $50 is $150. So then you go here to basic service, says 20% after deductible, 20% after deductible. Again, this is for a cavity. So 20% of 150 is $30. You're going to pay $30. 80% of 150 is 120. Mutual of Omaha is going to pay $120, and then they are going to reduce this $1,000 by 120. So it's $1,000 per year per mouth, per person per mouth, unless you add on ortho, and then you get another $1,000. But anybody who's got kids and braces know that $1,000 is cute, but it costs more than that. Let's talk about your eyes. It's also insured through Mutual of Omaha. I said it is insured through they. You know, most of us were born with 2, so Mutual of Omaha cares about both of them. iMed Network, you don't have a copay for walking in. You get a stipend of $130 off your cool guy or cool girl frames, and then you get 20% off above that. Now, if your lenses are as thick as mine need to be, I got to kind of shrink them down like that. I am not getting out for free. If that's your case, you might not either. Or if your vision's pretty good, you might get out for free. So you've got glasses and lenses or contacts at $130. So it's either or, it's not both and. That's what this once every means. So you either get glasses and frames or contacts, not both covered by Mutual at the same time. Rates are for employee, and then full meal deal down here at the bottom. Voluntary supplemental benefit plans. Both of these plans, their design is to send money to your mailbox if specified events happen. They don't coordinate with other insurance. So accident is if you get in an accident and you seek treatment. Or we had one of our colleagues whose son was a wrestler and just kept getting his shoulder yanked out of socket, and there was many doctor visits, and that's an accident. So she was mad with her son's maturity, but she was happy maybe that he finally got a little money out of his wrestling career. But don't go around at work saying that insurance guy said injure small children or teenagers for an insurance payment. That's not what I'm saying. The other policy here is a critical illness, cancer, heart attack, stroke, things like that. Depending on what it is and the severity, mailbox money comes to you if you have this policy. So folks like critical illness if they are concerned about those areas. Folks like accident if they're accident prone or they got kids in sports or something like that. This is more information about an accident policy. Here's these are called defined benefits, like it is already set up in terms of how much it pays if certain things happen. So, fractures, burns, dental, stuff like that. So that's what the accident policy is. Here's the premiums that come out of your paycheck. All of this will be on bswift as well, so you can see if it works for you. These are semi-monthly rates, by the way. Here's the critical illness information. Here's the things that it responds to right there, right here. So you can select different amounts of this that are lump sum payments, and you'll be able to move a button online to see how that impacts cost. That's how that works. Here's your cost right here. These are semi-monthly as well, and that'll be online. Travel assist is if you are traveling more than 100 miles away. We've had folks who lost their wallet. You can't go anywhere if you lose your wallet, but they got linked up with the travel assist, and actually the travel assist coordinated with several different entities, and they got home. So how about that? ID theft, kind of the crime of the 21st century. If you're enrolled in medical and basic life, it comes for free. So if that happens, it is a help desk to walk you through it. Premium only plan just means anything that we can pass from Kaspar to you without taxation, which is a good thing. We will. And the rest of this, boys and girls, is great late night reading material. We are not going to cover this for the sake of time. We will end here. Anne is in our office. She's like an insurance ninja who supports an insurance ninja in Trisha. All of your carrier contact information is listed right there. Please let us know if you have any questions, whether they're now or whether they're throughout the year. This is what we do, and we are happy to help. So thanks for tuning in. Let us know if you have any questions. Have a good day. Bye-bye.